The World Food Programme says the Ebola outbreak and food insecurity are deeply intertwined. More than 26.5 billion people in the DRC are facing acute hunger, according to the United Nations-backed food security experts. The current Ebola outbreak spread unnoticed for weeks as health authorities tested for the common Zaire strain before they realized this outbreak was caused by a much rarer strain called Bundibugyo. We examine the history of this deadly virus and disease in the DRC in our cover report. To understand how dangerous and devastating Ebola can be, you have to hear the harrowing stories of those who survived the ordeal, like Naluboa Sumaya, a 34-year-old mother of 4 from Mubende district in central Uganda. She recalls the trauma of her illness during a 2022 outbreak, describing how she lost awareness for days while receiving treatment.
I realized that I was in hospital after 2 weeks. I noticed I was in a diaper wrapped in a polythene bag, naked. But the government had provided us with bed sheets and clothes. Ebola outbreak is painful and it kills. So people of Kenjojo, I want to tell you as a survivor that if the government tells you to quarantine, to protect yourselves, everything they tell you, obey.
For years, the Democratic Republic of Congo has made headlines for deadly disease outbreaks, from Ebola to Mpox and even mysterious illnesses that doctors have struggled to identify. Ebola itself was first discovered in what is now Democratic Republic of Congo in 1976, and the country is now facing its 17th outbreak of the virus. So why does Democratic Republic of Congo keep facing disease outbreaks? Experts say it comes down to a mix of factors linked to the country, like the geographical location of the DRC, which borders 9 countries, which makes the spread of diseases more common and fast. And the border movement due to trade makes the situation even more precarious. The other factor is conflicts. Parts of the DRC have faced wars for years, which has forced millions to flee and as such in displacement, with many living in temporary camps and constantly on the move, which creates a perfect environment for infectious diseases like Ebola to spread quickly. Then of course, the conflict has destroyed the health system. This outbreak in the DRC is caused by Bundibugyo, a rare strain. The world has no approved vaccine, nor licensed treatment, and barely any experience fighting it. Bundibugyo is one of only 4 Ebola species known to infect humans, alongside Zaire, Sudan, and Thai forest. Yet, it's the rarest of the lot. The slower replication rate is deceptive. While Bundibugyo takes longer to incapacitate immune cells, the incubation period is the same, 8 to 10 days on average, up to 21 days. By the time symptoms appear, the virus has already spread.
This Bundibugyo strain, this is actually only the 3rd outbreak of it ever. And both of the first 2 have been quite small. Already we've had more reported in this outbreak than the combined number in the previous 2 outbreaks. So in terms of the clinical disease, nothing is different. But we don't have the treatment. We don't have the vaccine. We also don't have a really reliable diagnostic for it yet.
The existing Ervebo vaccine, which has been used successfully in previous DRC outbreaks, does not offer effective protection against Bundibugyo. Emergency use authorization would be needed for any experimental treatment, a process that takes time the world may not have.
So there are candidate therapeutics and there are candidate vaccines against the Bundibugyo strain. And I think in one of the pieces of good news about this is that already WHO coordinating bodies are putting the mechanisms in place to begin evaluating these treatments and vaccines in this current outbreak. Obviously, with something like Ebola, you can't test a new medicine on people that don't have Ebola. You can't see if it works unless you have Ebola.
This is the 17th Ebola outbreak in the DRC since 1976. Yet, this is the first time Bundibugyo has triggered a global emergency. The Kasai province outbreak that ended in October 2025 had 43 deaths and 42,000 plus people vaccinated. Bundibugyo was discovered less than 2 decades ago in 2007-2008. Bundibugyo has been neglected because it's so rare. Fruit bats are believed to be the primary reservoir, with all outbreaks occurring in the Congo River Basin region. Africa Bureau, WION, World is One.